Assalamu alaikum, Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the upper left 3, 4, and 5. As you can see on the 3D rendering, we've got a radiolucency which is causing a fenestration in the bone. As you can see very clearly here, this is perforating the cortical plate. On the panoramic view, you can see that we've got radio opaque material underneath between the 3 and the 4, and also in the apical regions of the 5. Now on the transaxial view, which is basically the proximal view, you can see this is the 3, and the 3 does not seem to have any chamber opening done, but we do feel like there is a cavity present in the 3 right here on the palatal aspect right there. So this cavity is very close to the nerve, and hence this could be a root canal. We also see a radiolucency underneath the upper left canine. As you're moving distally, you can actually observe this radio-opaque material which is lodged in the radiolucency and also has become part of the floor of the sinus. Now we're moving towards the 4. This is the interdental area, and here you can see the radiolucency continues and the radio opacity is present here as well. Now this radio opacity actually is stemming from the upper left 4. This is the palatal canal. There is a major radiolucency associated with the palatal canal and a major radiolucency associated with the buccal canal as well. And from here, we're presuming that this was some root canal filling material or calcium hydroxide, which was injected into the canal and now has dispersed into the cystic lesion, because we've got a very defined margins of the cystic lesion associated with the upper left 4 palatal canal. And this is where it's stemming from and spreading into the entire radiolucency, even in the apex of the 3. Now we're presuming the 3, if it is non-vital, then it is also necrosed and is contributing to the cystic lesion. Now moving to, this is the cystic lesion of the 4, and now we're moving towards the 5, and here we've got a root canal filling material extending from the 5 into the periapical tissues as well. And you can see that the obturation has been done, and the obturation material also here, the obturation material also here is, you can see very clearly, is part of the radiolucency, is part of the floor of the sinus. We've got a short GP in the buccal, and we've got an overextended GP in the palatal, as you can see on this transaxial view. And we've got a lot of radio-opaque dental material present in the periradicular tissues, which can be contributing to the infection, periapical radiolucencies, pain on biting, and overall pain to the patient on the upper left segment. So this is what we see. If there are any further questions regarding this case, please feel free to reach to our team. All these materials are actually contributing to sinus issues as well. So our advice to the doctor would be to either do an apical surgery to remove all of this dental debris, or do an extraction, clean the sockets out, so that this entire radiolucent material and radio-opaque material can be removed from the bone and the bone can be given a chance to heal. Thank you very much.